talking all about Invisalign. And today I'm here with Riley from the office, and she is going to break this all down for us. But first I'm going to share a quote with you. I don't know who said it. I think it's actually from a movie way back. But it says, "You're never fully dressed without a smile." It's actually a good thing.
Yeah.
A smile can mean so much. So when the Invisalign system was first developed, many of the aligner manufacturing processes were carried out by hand, and computer technicians had to modify each tooth in the computerized model individually.
Wow.
That's coming from Wikipedia. So that's actually a lot of work. It's
I know.
come a long ways since then.
That must be costly too.
Yeah, no kidding. So I don't know, do you have anything you want to share about Invisalign?
Yeah.
A story? Or?
I had braces and Invisaligns. I had braces when I was really young. I didn't really care about my teeth. My parents pushed me to do that.
Yeah.
I had it done. I had no idea what a retainer is. I had retainers. I never wore them. And 2 years after, my teeth went back to where it was. So then I grew older a little bit, and I start to notice my teeth. And then I even have friends, they laugh at my teeth.
Oh.
So I look at the pictures, I'm like, yeah, why did I not wear retainers? And I did not know that retainer exists. So, and then I start working in the dental office, and I know our office does Invisalign, so I decided to do Invisalign. Invisalign is the greatest thing I've ever had, because I do not want braces on my teeth anymore. I had a really horrible story when I had braces. I love eating noodles. Yeah. I tried to eat noodles, and my noodles get caught on each bracket. Oh, man. It was really bad. It was really bad. So Invisalign literally saved me. I had Invisalign. I had Express Invisalign because I had braces before, I guess, and I was younger when I had Invisalign, so it was faster. It was only 6 months, and I had my teeth straight. Like, they're very good.
Oh, they look great.
Yeah, and I never forget to put my retainer in every night.
Not anymore, right?
It changed my life. I like to smile a lot, and nobody laughed at my teeth anymore.
Wow, that's great comeback story. So what is Invisalign?
Okay, Invisalign, as everyone knows, it's very big, it's very popular, but it's actually the name of the company. I think they're the first ones started doing Invisalign. So Invisalign actually, they are a bunch of plastic trays, and then because the target is they're supposed to be invisible to the other people, and then they aligns your teeth. So they combine these two words together. And then you're supposed to wear them for a period of time, and then they will straighten your teeth for you.
Okay. Yeah. So how does that Invisalign work then?
Invisalign it is very it works the same as braces, the concept. So they slowly move your teeth to the way you want them to be, and at the end it just straighten your teeth. So your teeth, your bite, your smile, everything looks great.
Okay. So each week or every other week?
It really depends. Some patients, they're younger. Their teeth are not very crowded. So not the crowding, the level of the crowding is not too bad. So we do every 7 to 10 days.
Okay.
Normally it will be 2 weeks. But some patients, it's a commitment. You have to wear 22 hours a day.
Right.
We do have some patients that don't wear 22 hours a day. I do know if you have an Invisalign on, it might be a little bit hard to talk at the beginning. Yeah. So if you don't wear 22 hours a day, it might not work as good as it's supposed to be. Right. So you might have the Invisalign trays longer than 2 weeks. So that's why we want patients to come back every 6 weeks. To let us check to make sure everything is on the right pace.
So you just take the trays home and then just replace them as prescribed? Okay.
Yes.
Okay. What are the benefits of Invisalign?
The benefits of Invisalign, I know. First, nobody knows. Nobody can tell you have Invisalign. You're straightening your teeth. It's like, you put it in 6 months, a year later, your teeth are straight. Everybody will be like, wow, and then nobody knows what happened. Yeah. It's really good for, I would say, because it doesn't have the brackets on your teeth, so you don't have to worry about once your Invisalign is done. Like for braces, you have to take off the brackets, and then normally that's why the demineralization happens, because you have your brackets on with the glue on your teeth for too long. And also it's really hard to brush around the brackets.
Right.
A lot of teenagers, they start to have decay, brown teeth around the brackets. So Invisaligns, you don't have to worry about it. And also Invisaligns, it is a commitment. So you have to brush your teeth every time after you eat, floss and brush the trays. So it's pretty much a reinforcement to make you have a better oral hygiene.
Good habits, exactly. And braces kind of hurt the inside of your mouth.
I
Probably,
know. Sometimes it really depends on the doctor how they do it. I had braces. Every time when they put new wires on, sometimes sometimes the wire might stick out a little bit, and I just keep cutting my lips. That's not a good. I developed canker sore by that time.
It sounds painful.
I know.
So this is probably going to be a big question, but how much does Invisalign cost?
The cost is very varied. It's different for everyone. So our costs start from $6,500. Normally that's for 2 years of the length.
Okay.
And a lot of patients, they do need longer appointments or longer period of time to straighten their teeth. And then it's not according to us, it's according to the Invisalign company.
Gotcha.
But they do provide if you're trying to put your Invisaligns in and they didn't really work out, they do provide you a second chance, and that is free of cost. So they will change the whole plan for you, and then they will put it in for you, see how it goes. So you basically have Invisalign 2 times for the same cost.
Okay, if you need it.
If you need it,
So how long does it take to straighten your teeth with Invisalign?
It really depends. I had it for 6 months and I love it. Invisalign, the best part of Invisalign is if you're not happy of the way your teeth are, say by 6 months you're supposed to have straight teeth, you're not. There's always different ways we can do. First, we can replace the trays, we can do a second round, and then Dr. Yoo can also put some dimples on the trays. So we're moving the way you want your teeth to move. It's very flexible actually.
So it's really good to come in and have
the dentist. You don't really have to come in every 6 weeks if you have any concerns, but for that you can always give us a call and you can come in so we can check your teeth for you.
Customize it.
Yes,
that's awesome.
Yes.
So how painful is Invisalign?
It really depends on individuals too. I had the Express Invisalign that time. To be honest, it hurt a little bit.
It's moving fast.
It was moving fast. I did pop in 2 Advil that day, and then normally Invisalign trays are not supposed to hurt that much if you're doing a regular one. I will say the first day it might be a little bit uncomfortable.
Right.
The second day might be slightly uncomfortable. By day 3, it should be pain-free.
Right.
You shouldn't feel anything. If you're doing 2 weeks every tray, normally the second week you shouldn't feel anything. Even if you take off your tray, brush your teeth, put it back on, you don't feel anything.
Because normally when you're putting it back on, that's when you feel
it. It's where it is sore.
So is Invisalign as good as regular traditional braces?
There are cases that Invisalign cannot fix. There are cases that I did see a patient last week. Her teeth are very it is just so hard for Invisalign company to make a tray because it's very far apart. So for her situation, it might not be the best because we're moving too much, and then the root of the tooth, if we're moving too much and then too fast, it might not be good. It might have a root resorption or anything. So we might not. For braces, the good thing is you put the brackets down, you can slow down the process. So for Invisalign, it's pretty much computerized. So we, if we do it too fast, we don't think it's good for you. So besides that, everything else is pretty much the same. But Invisalign is also very, I would say, cost less than braces, and then do pretty much the same amount of the time, but force you to have a better oral habit, and also nobody can see, and it doesn't hurt your lips, doesn't cause any canker sore. So they both have good and bad side of that.
Okay, and had a question and now it's kind of gone. What would be the statistic, maybe you don't know this, of how many people you could actually help with Invisalign as opposed to the case that you said? Like, is it pretty high chances?
Yes. We so far we only had one patient.
Oh,
like
okay.
I work here for 8 years. That was the only one patient
Oh, wow.
that we actually
Just couldn't do
said
it.
no. We refer her out, and also it depends on the patient's age as well.
Oh.
Like if we see that patient does have a lot of cavities,
Oh.
like that was the case. That was the only case.
Yeah.
And patient doesn't really brush her teeth a lot.
Yeah.
So for Invisalign, you do have to commit to brush your teeth every time after you eat. So if we see that, we know that patient is not a good candidate, because then that's why we refer out. And then 99.99% of the time we say yes, and then patient come back with a very positive feedback.
Nice. Okay, so let's say I get approved. How long does it take to get started using Invisalign?
Okay. If we think you're a good candidate, normally we check with your insurance. If you do have the insurance, and if everything is okay, you say okay, then we take an impression.
Okay.
We have to customize your trays, and then we send it to Invisalign company. That takes about a week or two.
Okay.
Then they will send back, we call a clean check. So it's a computerized thing, and then we open up the program. So we have you back in about 2 weeks after the impression. We choose which way you want, or we choose together.
Yeah.
Say you want your teeth to move this way, you want your teeth to move the other way, and then how long you want it to move. Like how
rapid?
Yeah, and because you have to commit. You will do a good oral hygiene and everything.
Right.
And then if sometimes patients are going away for a vacation and they will be back in 4 months.
Oh.
And then we will make it out. We'll sort it out. How are we gonna do this? Right. And then Invisalign, this is a good thing for Invisalign. You can have your tray with you, and then we can customize the process. So you actually, if you're going away, every time you take a picture and then you send it to us, we'll tell you, okay, you're good for the next tray or you're not. So that's a very good thing.
That's really good.
Yeah, once you're approved for the clean check, we say yes on the computer, and then they're gonna start making the Invisaligns. Then about 2 weeks you will get your Invisalign. So about a month you can start your Invisalign treatment.
Okay, great.
Yeah,
good to know. Wow, lots of great info. Thank you so much for sharing
thanks for
all
having
that.
me.
Yes, thanks for joining us today here on YouTube, and don't forget to subscribe to the channel, like the video. This was a really good video, lots of great info, lots of good questions answered. And we'll see you guys on the next one. Bye.
Bye.